Welcome to episode 4 of our podcast, You Rise. My name is Mackenzie, and today my group and I will be discussing how climate change is impacting both the mental and physical health of many people worldwide. We will go in depth on events that may cause physical harm, such as temperature extremes, air pollution, limited food and fresh water supply, increased frequency of vector-borne diseases, and address any anxiety concerning these inevitable consequences of our warming planet. It is our goal by the end of this segment to educate our listeners and provide them with a better understanding of how climate change can harm our mental and physical health. It is also our goal to motivate them to make a change. So let's begin with climate change by the numbers. We are all told that making minor changes in our everyday life will help us in the fight against climate change. Recycle, carpool, use water and energy sparingly. If you lived car-free, your annual carbon emissions would be reduced by 2.4 metric tons. If you stopped eating meat, your annual carbon emissions would be reduced by 0.8 metric tons. For every one less child you have, you will reduce your annual carbon emissions by 60 metric tons. That is a massive number, and it is certainly something to consider in family planning. The decision of whether or not to have a child, whether it is because you don't want to expose your children to the dangerous effects of climate change, or that you want to limit your carbon emissions, can cause fear and anxiety in people. In recent months, Facebook groups and forums have been created by people who refuse to have children due to the current climate crisis. Their campaign is titled #NoFuture, NoChildren. 34-year-old Mason Cummings, producer for the Wilderness Society, had a vasectomy after deciding he could not morally bring a child into the world that doesn't have a second future. This is just one example of how climate change can indirectly affect mental health. I will now let my partner Hannah talk more about the impact that climate change has on physical health, and then Julia will continue with the mental health impacts.
Hi, I'm Hannah, and I'm going to talk about the physical part of climate change affecting us today. So currently, we all know that there's the coronavirus pandemic, and scientists have continuously reported that the United States is not ready to face a pandemic like the coronavirus, just so they have been telling us that climate change is occurring for decades. Science is necessary for society to understand and solve crises. Because political leaders continuously ignore science, we keep having to play catch-up. If climate change was not disregarded when research was first done, we would not be facing the impacts that we are now, such as flooding on the coast from seawater rise. Trump stated that the coronavirus was a hoax after firing his pandemic team at the beginning of his presidency, leading us to fall behind in resources, money, healthcare workers, and so much more. Just what will happen if we continue to set climate change in the back. United States hospitals are the world's 7th largest producers of carbon dioxide in the world. Recent catastrophes have shown climate change will affect the healthcare system's ability to meet the patient's needs. Some hospitals have started developing strategies to cut down on carbon emissions, which allow them to save money and improve health in an environmentally friendly way. The United States healthcare system produces around 10% of the CO2 generated in the country. Kaiser Permanente has reduced greenhouse gas emissions by 29% through using solar power and clean energy purchases in their hospital. After needing to rebuild following a devastating storm in 2001, the Texas Medical Center built a new heat and power utility plant that emits less carbon. Hospitals such as Spaulding Rehabilitation Hospital in Boston have been needing to change practices to accommodate for rising sea levels. Healthcare Without Harm shows how more healthcare systems can incorporate environmentally sustainable into their practices that will not only reduce the cost of care, but also decrease its carbon footprint. Hospitals can take small steps such as replacing fluorescent lights to lower energy LEDs, to bigger changes like installing air exchange systems based on whether operating rooms are in use to only exchange air that is necessary. There are also a rise in temperature-related deaths. A warmer future has direct correlation to an increase in future morbidity and mortality. Countries are going to need to start making plans for adaptation, mortality displacement, demographic changes, and so much more to the greenhouse gases changing the environment around us. The increase in temperature across the U.S. will lead to a much larger increase in premature deaths than the reduction in cold winters. There has been an increase in tolerance to warmer temperatures, but there are limits to the adaptation. If the trend of moving into urban areas continues, there will be an increase in the urban heat island effect, which will magnify the local warming, which could then lead to more heat-related deaths. On top of the rise in temperatures, there are also air pollution effects causing greater morbidity rates. Air pollution has become a global threat, especially regarding respiratory diseases. Air pollution comes from human activities such as industrial emissions, traffic, construction, and war, or even natural hazards such as earthquakes, forest fires, and extreme temperature. There is a direct impact of environmental effects on pregnancy and fetal disorders such as preterm birth, lower birth rates, and lung development defects. Past air pollution episodes have led to thousands of unexplained deaths, such as the killer fog in London that led to 12,000 unexplained deaths and severe long-term effects on human health. Industrial and rural areas face larger impacts from air pollution because of manufacturing, traveling, and the typical lifestyle in those areas. The human respiratory tract has protective barriers such as mucosal cilia and air-blood barriers. But when air pollutants accumulate, they pass through the lungs and cause damage. Particularly in children, pollution rates have led to a high morbidity rate of various acute respiratory infections. Non-smokers are now facing high rates of chronic bronchitis, which research is connecting to an indoor pollution. Smoking is considered to be the leading cause of lung cancer, but air pollutants are now known to contribute to the development of lung cancer. An accumulation of injuries from different types of natural disasters has increased with the worsening effects of storms. Natural disasters have always led to a humanitarian crisis with huge injury and death rates, but climate change has been worsening these events every year. Extreme weather events leave millions of Americans struggling to access healthcare, medicine, water, power, and much more. With a decrease in greenhouse gases, the extremities of these natural disasters will not be as bad and have a smaller impact on communities. Disasters can also damage healthcare systems themselves, making it hard to rebuild infrastructure. Healthcare systems now have risk assessments to disrupt the effects on emergency departments and reduce the negative impact from climate change. Over the past years, violent environmental events have become worse with an increased intensity and impacts on communities due to climate change. Hospitals in developing nations are not culturally prepared for climate change and the impact of the events about to occur. Natural disasters lead to a risk of drowning and injuries such as bruises, cuts or sprains, burns, wound infections, and more. These traumatic pathologies lead to an influx of hospitalizations and citizens needing healthcare, which will only get worse as climate change continues to increase in frequency and intensity of violent phenomena. Along with the increase of natural disasters, there's going to be a lack of resources such as food and water. Climate change comes with a major increase in resource competition and mass migration. Resources is a complex issue involving food, energy, water, and so much more, which makes climate change a more concerning problem as resources begin to disappear. Droughts drive up global food prices. The UN estimates 40% of countries are in water stress zones, defined as using more than 20% of their fresh water supply each year. Climate change is expected to have major impacts on agriculture productivity in Central and South America, which will increase pressure on the southern border of the United States with immigration. Conflicts are arising between countries in dispute about energy, agriculture, and industry. There is an increasing urgency revolving around policies needing to be made in regards to climate change and coordinating resources and tools available to reduce our vulnerabilities. Infectious diseases changes are indirectly linked to changes in vector patterns. More than half of the world is at risk of facing illness and disability because of vectors. Vector-borne disease rates are almost 300 times greater in developing nations than developed regions. With socioeconomic inequalities continuing to rise, the lack of access to healthcare for poor individuals, disease risks higher in areas of lower socioeconomic levels. Epidemics from vector-borne diseases have overwhelmed healthcare systems. Indirectly, climate and weather conditions have led to an increased exposure to vector-borne diseases. Climate change increases the amount of areas climatically suitable for transmission, leading to a widespread increase in vector-related illnesses.